And I always find it a challenge to explain to people why we should have a pain specialist, because it's a very popular specialty in Western countries, and we don't have the kind of people who are trained enough to treat people in pain. And when I talk about pain, I'm talking about chronic pain, persistent pains which have lasted for more than 3 months, 6 months. We always think it's part of the culture. They never complain of pain. It's a cultural thing in India. They never complain. But if you ask them, they do suffer, and they do suffer badly. Again, it's a problem with science, because in India we don't have the studies to say define the problem, how big the problem is. Western countries data it's a common thing in medicine wherever you go. We did a large study in India. We did more than 5 lakh phone calls, trying to find out what is the problem. Nearly 20% of people in India have pain at a certain point, which is poorly managed. It is not a problem which is a biological thing. It's just not a body-based thing. It also affects the psychology. If people are in pain, then they won't be able to go to work. They worry about their future. Who's going to look after my family? Who's going to look after my kid? Who's going to feed my parents? Am I going to end up in a wheelchair? Am I even going to get back to work? So these are all the psychological issues which goes through the mind, and we deal with those things as well. And it is across professions. It is not just the blue-collar workers, but also the doctors and nurses. So pretty much everyone suffers. So just to explain to you what we focus on, we treat more than 300 different kinds of pains, and as a multidisciplinary unit, I'm proud to say that we have one of the best in the country in Coimbatore. And we do a lot of what we call the interventional pain medicine. If someone, say the typical patient whom we see is someone with cancer. Okay, so pancreatic cancer is called a silent killer. It doesn't show up till the final stages, and by the time it's diagnosed, it's already advanced. And they only have a few months to live. And the first symptom with pancreatic cancer is pain. And they treat them, surgery, radiotherapy, whatever it is, and finally decide, well, this is all we can do from a medical perspective. So they go home and extreme severe pains, it is just not possible to bear that pain so much so that they literally say that, you just kill me, I'm only going to live for a few weeks, why don't you just kill me? But we have some treatments for that. We do some certain simple injections which destroys the nerves, so that it gives them good pain relief in end of life, and it is dignity when you die, and that's very important, because having lived a successful life as a father, as a husband, as a son, it is just not a humane thing to die in pain, and we do that. And it's only a sample of that. We do a lot of other things as well, mostly what we call the interventional pain medicine. We block the nerves, we stun them so that they get some good pain relief. And the cancer pain, I'm talking about it only because Ramakrishna is quite popular from a cancer perspective. And it's just not the adults and the elderly who have cancer, we also have kids suffering from cancer. 3-year-olds, 4-year-olds, it's literally sort of heart-rending when you enter into the pediatric cancer. And they do have pain. How can he or she explain that she's in pain? And the typical child is someone who's held close to the mother's bosom. And she's got a cancer which is spread to the brain. And absolutely nothing we can do, because the kid can't express pain. And the facial expressions of and the thing is, we give them certain medicines off license. You're not supposed to use it in pediatrics, but we don't have any option. And we have the courage, and we have the knowledge and the skills to use such medicine in kids. And this is a 2-year-old kid who died peacefully just a few months ago. And we use medicines in a certain way, which made his life quite sort of comfortable in the end of life. Just the back pains, knee pain, shoulder pains. We do a lot of things, interventions, simple nerve blocks, and we follow that up with rehabilitation. Pain the reason why you want to get the pain reduced is to make you functional, to make you walk, to do things which you enjoy doing. It might be work, it might be leisure, it might be a holiday, but that's the whole idea. So we combine that with the physiotherapy, where we teach them different types of exercises, self-management principles. We talk about things like yoga, we teach them yoga, and we also teach them martial arts thing, the Chinese thing, Tai Chi, which seems to help a lot of people with back pain and knee pain. And we also combine it with psychology. There's a lot of psychological issues. If you have pain for more than 6 months, automatically those things come into mind. There is anxiety, what's going to happen to me? There is depression. Why should this happen to me? There's a sense of helplessness, there's a sense of hopelessness, and a lot of things. And we also have a term called catastrophizing, imagining about the worst possible situation when you have back pain. Okay, I'll take some medicines, I'll take some rest, and I'll get back to work. This is a normal thinking. But some people might wake up in pain and think, ஐயோ முதுகு வலிக்குது எனக்கு என்ன போகுது எனக்கு ஏதாவது கேன்சர் வந்துருச்சோ எனக்கு வீல் சேர் தான் தேவைப்படுமோ அப்படின்னு so you think about the worst possible situation. So we kind of deal with all sorts of psychologists. It's a multidisciplinary approach, and this is what we do at Ramakrishna. And from my perspective, we run a huge pain education project, the world's largest pain education project, based in Coimbatore, where it's an NGO, it's a non-government organization. We go and teach the doctors, particularly the junior doctors and nurses and physiotherapists, how to manage pain well. And it has been recently shortlisted for the prestigious British Medical Journal South Asia Awards in the category Excellence in Medical Education. And we've taught more than 15,000 students so far across India, and pretty much every week. Won a lot of awards, including International Award for the Best Pain Education Project, and we've also got the Special Interest Group Awards, and a few scholarships for our own. And we have 150 trainers across the country. And across the country, I mean, even places like Chhattisgarh and Ranchi and Jharkhand and places like that, we have trained them. And the recent thing is we have formulated a curriculum and asked the university, which is the MGR University, which trains all the doctors, to start a postdoctoral fellowship, and that has been approved. And this is the first time in the country, and we will be starting it at Ramakrishna Hospital, and it's a pride for Coimbatore, I would say. Once we get it, we will be starting it. So this is our the educational activities. So that's about me in a nutshell. So we do a lot of clinical services, and we also provide educational sort of training to doctors and the healthcare professionals. And I mean, it's a little bit. I feel a bit peevish here, standing in front of you, saying, "Well, refer business to me." Honestly, I don't expect or I don't want anyone to consult me for pain. I wish you all a very healthy, pain-free life. But if you do need, or if you do have someone in the family who might need help, then I'm always there. So thank you very much for listening. Thank you.
Last one, I like you, Doctor. He always wishes a lot of good things for all of us. And we have seen it is not about business that what we give, but we have seen a lot of elders who are suffering with a lot of pain. Yes or no?